Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about a very important as well as common topic, which is nothing but hypothyroidism and its relationship to PCOS. See, many patients, especially walk-in as well as online clients, whenever they come to us for doctor consultation for PCOS, we ask them for investigations, right, to confirm PCOS. They have USG reports, they'll get their hormone profile, they'll get their CBP report. But whenever we are asking them for the TSH or the thyroid profile report, they're just too scared. They just tell us, no ma'am, we do not have any sort of thyroid symptoms, we don't have a family history of thyroid. They just panic on the word of hearing thyroid. Many people do not understand that hypothyroidism is a trigger factor for PCOS, and also it can maintain PCOS. That is why it is very important to get your TSH or your thyroid profile done if you are someone who is suffering from PCOS or even PCOD as well. So in this topic today, we'll be discussing how it is trigger factor for PCOS, what are the common symptoms of thyroid and hypothyroidism and PCOS, and how it maintains the PCOS, as well as how it can cause or be indirect cause for infertility. So let's dive into the topic to know more about it. We will be discussing it on the screen so that you will understand it in a better manner. Today we are going to discuss about hypothyroidism and its relationship to PCOS. So what is the connection between PCOS and hypothyroidism? How are they influencing each other, and what are the common characteristics of hypothyroidism as well as PCOS? You have to understand that PCOS and hypothyroidism both are hormonal disorders primarily. Both affect ovarian function, or they directly affect the ovaries, and both cause differences in LH and FSH level, that is luteinizing hormone and follicular stimulating hormone. And not only that, they do cause insulin resistance, and on a longer run, if not taken care of and if no medication is used, they can lead into type 2 diabetes. So these are the common factors between hypothyroidism and PCOS, and we will see how are they connected and how they are causing all of these symptoms, which are most common in both kind of diseases. So here we will be studying about the common characteristics of hypothyroidism as well as PCOS. If you see this picture, you might have been seeing this picture since your childhood. It's a mathematical picture wherein we see what is different in both and what is common in both of them. In PCOS, the different feature from hypothyroidism, although in some hypothyroidism patients you can find acne, but it's most common in PCOS, as well as hirsutism, which is unwanted hair growth. And then in hypothyroidism and subclinical hypothyroidism. What is subclinical hypothyroidism? It is not fully proven, or fully, there is no serum level which is exceeding too much, that the TSH level is below 6, your T3 T4 have not fallen too much, or in their marginal low level, then that is called a subclinical hypothyroidism. And hypothyroidism is fully proven or fully blown hypothyroidism symptoms that appear in the body, right? So both of them can have constipation, can have body pains, that is myalgia, can have cold intolerance, which is very, very specific to hypothyroidism. Okay, and then what are the common features present in both of them? Yes, hypothyroidism does have or causes irregular menstruation. Many people think that the moment they experience irregular menstruation or scanty bleeding, they just feel I have PCOS. Remember, it can be because of PCOS, but if it is not because of PCOS, it can be because of hypothyroidism also, and it can be a combination of both of them that is causing irregular menstruation. So irregular menstruation, obesity is common in both of them, whereas in PCOS it's more of fat deposition. In thyroid it's more of fat along with a lot of water retention also you get to see in hypothyroidism. And then infertility, yes, hypothyroidism can cause infertility, and also PCOS can cause infertility. And then fatigue, which is like a drop of energy throughout the day, and then low mood or mood swings, it is found in hypothyroidism, though people do not recognize it, although it is much recognizable in PCOS. And then hair loss is common in both hypothyroidism as well as PCOS. And then now we'll get to know what is the effect of hypothyroidism in PCOS, or how hypothyroidism causes irregular menstruation, and how it causes infertility, how it causes anovulatory cycles, and how it causes a cyst in the ovaries, and how it can maintain PCOS as well. Through this flowchart, I'll be explaining it to you in a much clearer manner how hypothyroidism can cause or can trigger PCOS. So let's get into it. As you know, hypothalamus is the main thing that releases GnRH. If you have seen our previous videos, you would understand that PCOS is also related to GnRH pulsations or the release of GnRH, right? But in PCOS, we have too much or excessive release of GnRH, whereas in hypothyroidism, we have very low pulsations or low amount release of GnRH. Why? It is because of too much secretion of TSH. Remember, hypothyroidism is low level of T3 and T4 and too much production of TSH, right? So whenever there is too much production of TSH, there will be hyperprolactinemia, which is increase in prolactin levels in the body, which will cause the GnRH to reduce, okay? And when the GnRH is reducing, what happens? The pituitary is not properly triggered and it does not release the proper amount of luteinizing hormone and follicular stimulating hormone, which is very important for what? Follicular stimulating hormone is very, very important for maturation of the Graafian follicle, that is a release of the egg, as we can say. Okay, so the egg should be released, right? So there is no release of the egg without follicular stimulating hormone being in a proper level. So there is decrease in FSH and LH. So what happens to the ovarian follicles? There is formation of fluid, or whenever a follicle is trying to mature, whenever there is no proper FSH to the follicle, what happens is that there is formation of fluid, excess fluid in the antral follicles. So they develop into cysts, okay? So follicles do not grow, they do not mature properly, they do not grow properly, and then the antral follicles or the follicles as such can develop into cysts. And whenever developing into cysts and there is no release of ovum, that is called nothing but anovulatory cycles, which are also present in PCOS, right? And then what it does is, see here, there is no ovum at all, so there is no chances of pregnancy, right? So there is infertility. And by chance, if you're having ovulatory cycle, what happens is that the uterus endometrium is also, like, it's very liable to the progesterone and to the estrogen level, right? So what happens whenever there is no formation of Graafian follicle, or whenever there is no release of the egg, what happens? There is no formation of corpus luteum. Okay, so the corpus luteum is something which is responsible for the production of progesterone. Fine. So the progesterone level is very low. Whenever there is low progesterone, what happens? The endometrial thickness is not proper. Okay, remember that every time, for every menstrual phase, our body prepares so that we will have a baby. That is, endometrial thickness will start to grow. Whenever there is low progesterone, what happens? Endometrial thickness will be very thin. So even if you are conceiving in the fallopian tube, that is, fertilization takes place in the ampulla of the fallopian tube, right? So whenever there is fertilization in the fallopian tube, it moves to the uterus for implantation. What is implantation? It sticks to the uterine wall and the baby grows there. Whenever there is thick or proper endometrium, the baby will grow properly. But whenever there is thin endometrium, it can rip off, leading to miscarriage, or as we call abortions also. Okay, so that is also the reason why people experience miscarriages when they have thyroid issues, in cases where they are not using proper medication or the dosage is not set right to their body. Okay, it's very, very important. If you're someone who's watching this video, if you're pregnant, do get the profile, whatever profile your gynecologist is suggesting you, do get all of the serum profiles done very regularly. And also watch over your consumption of goitrogenic foods. What are goitrogenic foods? That is cauliflower, cabbage, papaya, even ragi comes under goitrogenic agent. Avoid all of these goitrogenic agents, and then try to concentrate on eating good food and also exercise properly. If you're pregnant, do Kegel exercises. Do not do any sort of other exercises which will hamper the health of the baby. Okay, and that is why it is very important, if you're trying to getting married also, make sure that your TSH level is proper. And then how is the effect of hypothyroidism on PCOS? We have seen that already. Remember that not only the fertilization factor or the female reproductive system is involved. Remember, PCOS is a syndrome wherein the whole body is involved, majority of the body parts are involved. In the same manner, TSH or this hypothyroidism is also a hormone which almost acts on every cell of the body. Okay, it has effect on every cell of the body. So what happens? Apart from this, there is insulin resistance happening. It happens in PCOS, it happens in hypothyroidism. If it is happening in hypothyroidism and you don't have PCOS, on a longer run can create a PCOS, and if you're having PCOS, on a longer run it can create hypothyroidism. Both will maintain the insulin resistance, and if both are not taken care of, they can lead into type 2 diabetes. And how is the androgen level increasing in thyroid? We know how it is increasing in PCOS. If you have any sort of doubts on it, we will be providing a link in the description box about the PCOS, how is it formed, or how the syndrome develops, and what are the causes and effects of it, and how should you diagnose PCOS, right? So that will be provided in the description box. Remember that. And then the androgen level in hypothyroidism is increased because the TSH has an effect on the testosterone metabolization, where there is increase in testosterone through an indirect cycle. That is why there is hyperandrogenism present even in hypothyroidism. Apart from that, there is impact on fertility, which we have already spoken, because of anovulatory cycles and very thin endometrial thickness, or abnormal endometrial thickness also sometimes. You have to understand that PCOS and thyroid are interrelated. They are just like siblings, or you can say best friends. If one person is there, the other will sooner or later come. So if PCOS is there, if it is not properly taken care of, can lead into hypothyroidism. Hypothyroidism can lead into PCOS, and both of them can cause ovulatory dysfunction. Now coming into the conventional form of treatment, if you are suffering from hypothyroidism along with PCOS, what are the medications that your gynecologist or your MD general would suggest you to use? The allopathic form of medication. These four particularly are for PCOS, and this one is for thyroid, or your MD general or your endocrinologist would suggest for your thyroid. So if you're taking these four, which are for PCOS, they have contraceptives, hormonal contraceptives. They have their own side baggage of side effects, where there is severe weight gain, there is acne, there is hair fall, there is oilier skin, and there is fatigue. And then if you're stopping hormonal pills, you can experience mid-menstrual bleeding as well. So apart from not curing the condition, they are just to manage the condition, and even in the managing section also, they do come with some side effects. Okay, along with that, anti-androgens, these are for maintaining the androgen level. Whenever you're using anti-androgens, the androgen level is maintained for some time, and then after you stop using it, again the condition reverts back. That's something that you have to understand. And low dose steroids and GnRH agonists or antagonists, they usually create a menopause like symptom. So whenever there is menopausal like symptoms, if you're someone who wants to get pregnant, or if you're going to get married, then this is not something you have to look forward for, because menopausal symptoms, dry vagina, pain during intercourse, and also there are less chances of getting conceived. And then we have the last one, which is levothyroxine tablets, which are for thyroid, or which is for hypothyroidism. See, whenever you're using these tablets, the thyroid level can be maintained, but after you stop using these tablets, the thyroid level can again fluctuate if you are not taking medication which will alter the pulsations of TSH. And also, this medicine, as long as you're using it, it's fine. The dose should be proper for you, and also people who should use it for lifelong. There is no going back, right? But we need medication wherein you don't have to use a medication for lifelong, where there is a medication which is safe, which is effective, which is treating all of the diseases without going to different doctors. That is nothing but homeopathic form of treatment. See, whenever you're experiencing thyroid, if you're already using this thyroid tablets, understand, even if you're going to a homeopathic doctor, that you should not stop your thyroid tablets like the next day you're visiting a homeopathic doctor and you stop everything. That doesn't work like that. Your body is used to certain tablets, so you have to tamper down the dose. Okay, you have to tamper down each and every dose that you're using, and come to a stage where there is very little medication, and then there is no medication at all, and you're completely relied on homeopathy, and then treat you constitutionally and miasmatically, and then tamper down the homeopathic dose as well, and then you attain a sort of cure for your case. Okay, so this is how it works. Many people, whenever you visit homeopathic doctors, they just switch off all their tablets. That doesn't work. The body will go through a lot of changes on a very short period of time, which is not favorable for good prognosis. You have to remember that. So how does homeopathy help actually? Homeopathy is completely safe, so it doesn't have side effects. First and foremost thing, as long as you're using it, you do not go with the baggage of side effects. It's effective in curing your PCOS condition, where where there is understanding of the link on how the PCOS has originated, how it's going and what is the prognosis of it. By studying your case, we will be able to give you medicine which will treat you holistically, mentally and physically, connecting with the symptoms. The medicine will be given to you, and that medicine will be able to alter or maintain the hormonal fluctuations. It will be able to maintain the TSH fluctuations. It will be able to maintain your mood swings, your period irregularizations. We will be able to regularize all of this on a longer run. It depends upon your disease. See, if you're coming with the subclinical stage, then that's a different kind of a treatment. Fully blown stage, then that's a different kind of treatment. Complicated stage, and that is a different kind of treatment. So it depends upon the case and how the case is prognosing. Not every case will require the same amount of treatment or same amount of drugs or same drug as well. Every individual, even though they're suffering from the same disease, will receive different kind of medications, and that is the beauty of homeopathy, because it's tailor-made. Okay. And then if you understand all of this, taking homeopathic medication, you will understand that the rate of recurrence of these diseases compared to allopathic form of treatment is very less in homeopathic form of treatment. And then we will be able to relieve your case, cure your case on a good timely fashion, and then prevent future recurrences. This is something that you should be understanding, and this is completely safe. If you're someone who's suffering from female reproductive organ diseases, we have discussed how homeopathy is a better stand than allopathic form of treatment, and in homeopathy, Fidicus homeopathy gives you a best chance at health. If you're someone who's suffering from all of this, we have two kinds of consultations, which is online and offline consultation. If you're staying nearby the nearest branch of Fidicus, you can contact us in person, or you can come in person and contact us or take a consultation with us. And if you're someone who's staying far away from us, you can contact us online through audio consultation options or through the video consultation options, right? And after consultation and after the investigations have been verified, especially to the online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, 3 to 5 business days. And apart from that, across the globe, anywhere, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us or know more about us, you can contact us on this number, call us, WhatsApp us, or message us. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. We have discussed how homeopathy is a better choice in treating lifestyle disorders, right? And we will now discuss why Fidicus Homeopathy is a better choice, because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. 1, we have already having good or high success rate in treating PCOS, PCOD, bulky uterus, dysmenorrhea, fibroids, endometriosis, adenomyosis, as well as cervical erosion. So we have high success rate in treating these cases. Apart from that, we have transparent treatment. What do you mean by transparent treatment? There is no gray area between the patient and the doctor. The prognosis will be clearly explained to you, and the personal care here at Fidicus is top notch. We will be answering all of your questions and letting you know if there is something that your case demands. If you want to choose health, if you want to choose cure, choose Fidicus Homeopathy. So guys, we have understood about how hypothyroidism will affect PCOS, how it is going to maintain PCOS, how it is going to cause anovulatory cycles, how it is affecting the fertility, and how both PCOS and hypothyroidism, they maintain each other. You have understood all the relationships, right? If you have any sort of doubts regarding this hypothyroidism and PCOS topic, you can call us or WhatsApp us on the given number, or you can comment in the comment section. If you have any sort of doubts regarding any other medical topics also, we are ready to do about it. So you can comment in the comment section regarding the topic and your doubt as well. We will be reading it and we will reply to you. And also, if possible, we will make a video on it. So meet you all guys in the next video. Thank you.
Fidicus Homeopathy.